Hi, Dr. Raj here, and today I want to talk about a topic that's near and dear to my heart. It is idiopathic hypersomnia, and I always feel it's underdiagnosed and misdiagnosed in many of my patients. So I'm bringing this up because there are revisions to the ICSD-3 guidelines, International Classifications of Sleep Disorders. It's called the text revision. But they made changes for type 1 narcolepsy, but not for idiopathic hypersomnia. So let's actually review that diagnostic criteria. So number one, what is the main complaint? Excessive daytime sleepiness. And number two, how long you got to have these complaints for? At least 3 months. Remember, it's always a diagnosis of what? Exclusion, hence the word idiopathic. So they are not going to have any complaints of things like cataplexy. So if you want to make the diagnosis, what do? Well, let's start off with our classic MSLT, multiple sleep latency test. What do we do first? Well, 2 weeks prior, I love a sleep log. I like a sleep diary. Maybe you'll do some actigraphy. You want to talk to your doctor to make sure they stop certain meds like antidepressants and make sure you're not going to be on stimulants. And this has to be done very, very safely. Then when you come forward, the PSG that we always do before an MSLT, you're going to take a drug screen. So don't do drugs. And then we do the nighttime polysomnography to make sure you sleep at least 6 hours. There isn't any other cause of excessive daytime sleepiness like obstructive sleep apnea. And then you do the MSLT, the napping study. You get 5 opportunities to sleep. And each nap is going to be 20 minutes. And if you do fall asleep, you get 15 minutes to go into REM sleep. And what is the memorized diagnostic criteria? The mean sleep onset latency has to be less than or equal to 8 minutes. And you got to have 1 or less SORAM. So what are going to be some other diagnostic criteria to have? Well, you could do a 660 minutes of total sleep time on a polysomnography. Good luck trying to get that. But if they let you, if you get 660 minutes, that's 11 hours of total sleep time on a polysomnography. That is unremarkable for other things like OSA. You nailed it. And the last thing is actigraphy. And what does actigraphy mean? It's going to be, you're kind of like activity monitor. It's like the truth behind your sleep. You're going to wear something like a wristband that monitors your movements. And if you show that you're getting at least 11 hours of sleep per night over 7 days in that right clinical setting, that's also considered diagnostic of idiopathic hypersomnia. I would know these diagnostic criteria for your board exams, and those are my high yield pearls for today.